Let's talk about this study that looked at the doses of liquid medications. A shocking number at the top. 85% of parents did it wrong in some way.
The remarkable thing is this has been a big issue for adults for a long time, but the thought that we have that many parents making a mistake is mind-blowing, and it gets even scarier than this. The reason they're making mistakes is because it's really quite complicated to understand it. So if you look at how often it's a big mistake,
yes,
20% of the time they double dosed. Think
Too
about
much.
that. Too much.
That's scary.
Yeah. The vast majority of all the mistakes are overdosing anyway because moms don't want to make a mistake. They want their kid to get it all. But in 21% of the cases, it was twice the dose you're supposed to give. Imagine being given a pill by a doctor and taking 2 of the pills instead of 1. The question becomes, why is it kids are having such a big issue? Why are moms unable to keep up with what's happening?
And do we have an answer?
We do have an answer. It turns out, not surprisingly for moms, but for doctors, we're just figuring it out. Those usual tactics we use to give you dosing, 1 teaspoon, 1 tablespoon, get a little cup. You know, what does that mean?
Right.
All spoons are different sizes. And so the cups in particular are a problem because the cups, 4 times more likely you'll get it wrong versus having a syringe with little markings on it.
It's funny because to me, and we, you know, if you do liquid Tylenol or something for a baby, you use the syringe. I find the syringe to be kind of intimidating, but that was the most accurate method in this study.
By far the most accurate method. Most people don't think about it as an important part of what they're doing, but I want to change that right now. This study is really important because it's going to guide the major associations that help give guidelines to manufacturers, but also medical groups to say, listen, stop using a cup, for example, because the cup, you got to lick the bottom to get the right dose. You have to look at it to see if you got the right amount in there. It's hard to do. From now on, I think there'd be a little gift that we all get for ourselves.
Okay.
You buy one of the syringes. Stock up in case you got an emergency. Don't rely on a cup or crazy other utensils you may have in your home. And also, don't get confused by milliliters or cubic centimeters and all these different measurement tools. It should be really clearly stated, which I think manufacturers are going to get. But get some of these syringes. I was going to get you some. I couldn't go to a store early enough today.
Okay.
Well, present from me to you.
I know. Come back. I'll take them. Okay, Dr. Oz. Thank you.